There are three misleading statements I oftentimes hear people get from insurance companies, their agents, or their brokers, sometimes even the government. So I want to walk through these three misleading statements that are so common so you know what to look for and how to address those when someone tells you this. I'm Emily with the Medicare Coach. I'm an independent Medicare advocate, helping individuals easily navigate Medicare rules as well as insurance company options to do what's right and best for you, to both protect your retirement savings, but to also have that best healthcare for your preferred provider, whether you're healthy or you're sick. So today is all about clarity, and in the section below, I'll include extra resources to help you get a jump start on Medicare, to easily navigate it, to get the most out of Medicare. Medicare can be fantastic when you do what's right for you. So let's hop into the three common misstatements I've heard people make when it comes to Medicare. And the first one is, you can change plans in the future. That's not technically true. Medicare rules allow you to easily change Medicare Part D, as in drug plans, as well as Medicare Advantage plans during certain periods of time. However, we are not, in most states, guaranteed to join or change Medicare Supplement, also called Medigap plans, every year between letters or even companies. So when a person tells you that you can easily change plans every year, just pick a plan for now, that's not really the truth. Again, because of Medicare's guarantee issuance or insurability rules around Medicare supplement plans, when you first join Medicare, you can do whatever you want, no matter what your pre-existing conditions. But in most cases, if you try to change that supplement plan, join a new one, switch companies, switch plans, any of those things, in most states, you have to go through medical underwriting, and they're not required to accept you. Many people assume that the Affordable Care Act, the Obamacare rule around waiving pre-existing conditions, applies to all parts of Medicare, and that is not the truth. So if someone tells you, oh, you can change it every year, that's a red flag. Be aware of that and make the right decision when you first join Medicare. Yes, you can make tweaks to Part D or Advantage, but what we tend to see is that people join Medicare when they first begin Medicare, and that Advantage plan works really well for them when they're healthy. But as soon as they have health issues, in most cases, you want to go back to original Medicare with a Medicare supplement plan. And because of how their rules work, you're not guaranteed to get that in the future. So please be thoughtful, know which plans can or cannot be changed, and make an informed decision when you first join Medicare. The second thing that I oftentimes hear people say is, well, you should just pick the cheapest plan. That's oftentimes misleading. They usually refer simply to premiums, right? Pick the plan with the lowest premium. That's not always the case. Let's go through all the different plans and talk about why that's not true. Let's start with Medicare Advantage. Yes, many Advantage plans have a $0 premium, but that doesn't mean you have no costs with it. Okay, number one, most of you will also pay Medicare Part B premiums. But two, Advantage plans will still have copays, deductibles, maximum out of pockets, things like that. So when it comes to Advantage, yes, look at premiums, but there are a lot more costs to look at to decide ultimately which one is right and best for you. We had a client who was able to save $1,000 by paying slightly more in premiums because his other Advantage plan covered her medications at a much lower cost. So look at all the costs involved and make the right decision. When it comes to Part D, the lowest premium is not the best unless you take no medications. Now, if you do take medications, though, we have to look at more than just the premium. We want to look at pharmacies, we want to look at copays for your medications, and total overall costs. It's not just about the premiums. And finally, Medicare Supplement, also called Medigap, is not just about the premiums either. Yes, premiums should be taken into account, but because of most states' insurability rules, we want to pick a company that we trust in the long term. We have seen many companies who come in and undercut their supplement premiums to make them really low, and then they just increase them the next year, and you're stuck because of how the rules work. So please be thoughtful and thorough. Do not just pick out a plan that has the lowest premium. Now, the third thing that I oftentimes hear people saying, which is also misleading, is that you must join Medicare. That's not usually the case for most people. Medicare rules say by the time you're 65, you either have to be on Medicare or covered by an employer health insurance plan, which meets Medicare rules. And with more and more people working past 65 or having a spouse past 65 who's working, you might not need to join Medicare. Now, I cover this in more detail in my free workshop, but my point is this. If people tell you that you have to join Medicare, that's a red flag as well. Usually paying for both an employer health insurance plan and also paying for Medicare is a complete waste of money. So be thoughtful, be thorough, and do what's ultimately right and best for you. Again, I'm Emily with the Medicare Coach. If you found this helpful, make sure you follow along, give us a thumbs up on this video, and I look forward to helping you easily make your right Medicare decision for your unique situation.